My name is Michelle Lanspa, and I am a second-year medical student at Nova Southeastern University, Dr. Kiran C. Patel College of Osteopathic Medicine. Thank you for taking a look at our research that sought to evaluate emotional health of U.S. osteopathic medical students at the onset of the COVID-19 pandemic, and the need for novel or modified mental health services for medical students specific to pandemic outbreaks. We hypothesized that lower levels of resilience and coping skills would significantly contribute to lower levels of emotional well-being in osteopathic medical students during the onset of the COVID-19 pandemic. Our rationale for this study was that we thought it was an important study to pursue because, first, mental health among medical students and physicians continues to be a professional concern given the high rates of burnout and suicide relative to other professions. Prior studies have shown that medical students in general can be especially vulnerable to emotional distress due to the significant challenges in their learning environment. For example, medical students have been shown to initiate their graduate studies with better mental health indicators than their age-matched peers, but during the course of their studies, the prevalence of psychological distress increases compared to that of the age-matched general population in the United States, Canada, Australia, and China. Given the restrictions on in-person learning with the current quarantine measures, osteopathic students specifically have additional concerns, like achieving professional competence in osteopathic manipulation therapy, and in facing uncertainty regarding educational testing timelines for 2 different licensing exams. Given the added stress and isolation due to the COVID-19 pandemic, while many are researching the emotional well-being of first-line responders and other healthcare workers, to our knowledge, no other U.S. study of osteopathic medical students has investigated these variables vis-a-vis the COVID-19 pandemic. I've included here some excerpts from our literature review if you'd like to ask questions about that later. Focusing now on the materials, methods, and settings. To address these questions, we carried out an observational, online, survey-based, cross-sectional study of current osteopathic medical students. We developed a questionnaire called the Emotional Well-Being in Medical Students Questionnaire, which includes several verified scales in order to determine how these variables may contribute to their emotional well-being. Here is a list of the scales and several examples from each. The questionnaire included the following scales: the Brief Resilience Scale with 6 items, the Brief Cope Scale with 28 items, and the Higher Mental Health Continuum Scale with 14 items to score emotional well-being. Additionally, we added 2 items to our assessment battery to evaluate other health behaviors. 1, I've been exercising less than usual, and 2, I've been sleeping more than usual. Our results from May through June 2020, we received 202 responses from osteopathic medical students in years 1 through 4. Demographics-wise, we had a pretty representative sample because it was a fairly even split of students in their preclinical years, years 1 and 2, and clinical years, years 3 and 4, as well as with gender, with nearly 60% of respondents being women. Multiple linear regression analysis indicated, as hypothesized, that the levels of coping, personal resilience, and certain health behaviors, i.e. sleeping well and exercising, explain a significant amount of the variance in emotional well-being scores in U.S. osteopathic medical students during the first months of the COVID-19 pandemic in the U.S. Higher levels of resilience, greater use of coping strategies, not sleeping more than usual, and not exercising less than usual made significant contributions to emotional well-being. Given these findings, we concluded that osteopathic medical schools might benefit from providing a model for comprehensive care through compassionate and holistic evaluations of students' physical and mental health needs, and as a proactive stance to promote personal resilience in students who will soon be on the front lines of this health crisis and of others. We've outlined some osteopathically principled interventions here that might warrant consideration and study given the findings of our research. Some examples include exploring exercise reward programs, preventative OMT to maximize respiratory mechanics among students, individual diet and nutrition reviews, incentivized group meditation, further study of coping mechanisms that have increased during COVID-19 like drug and alcohol use, and student involvement in research and advocacy to prevent long-term sequelae of COVID-19 like chronic fatigue syndrome. Thank you for listening. You can scan the QR code at the bottom right for my contact information if you have any questions. Thank you again.